It was tough going on Capitol Hill today. Thomas Frieden, director of the CDC, got an earful at a congressional hearing about the federal agency's response to Ebola so far.
People's lives are at stake, and the response so far has been unacceptable.
The administration did not act fast enough in responding in Texas. Bottom line is using the most accurate data and information to inform our actions and protect health. We're open to ideas for what we can do to keep Americans as safe as possible as long as the outbreak is continuing.
Then on Beacon Hill, nurses expressed alarm at a legislative hearing on Ebola preparedness in Massachusetts. WGBH News reporter Ron Sanders was there.
The Massachusetts Nurses Association says very few of their members are prepared to deal with a potential Ebola crisis. That's what Union President Donna Kelly Williams told us before testifying. She says hospitals may say they're ready, but so far, the only people to be infected in the United States are nurses.
Many community hospitals that we have nurses calling saying the equipment that they have at the ready is inadequate. It's not consistent with CDC guidelines.
What needs to be done? The CDC has to step in, yes?
CDC not only has to step in, but there needs to be an enforcement of protocols that are the same for every hospital.
I want to thank everyone for taking the time to come.
In the hearing before the Public Health Committee, Dr. Paul Bittinger, Chief of Emergency Preparedness at Mass General, told lawmakers that federal budget cuts have made it more difficult to prepare for Ebola cases.
Funding for public health emergency preparedness is essential in supporting our readiness and unfortunately has been on the decline at the national level. Similarly, funding for healthcare emergency preparedness in hospitals has also been on the decline, decreasing 38% in the last year alone.
One of the top medical experts who testified, Dr. Michael Van Rooyen, says the war on Ebola won't be won in hospitals. This threat will never stop unless we stop it at its roots in West Africa. For WGBH News, I'm Ron Sanders.
For more on the questions surrounding our response to Ebola, Dr. Hillary Cranmer is the Director of Disaster Response at Mass General's Center for Global Health. Welcome, Hillary.
Thank you very much.
So we heard your pal there, buddy, Paul Bittinger, responding today. He was saying it's a matter of federal money, but I don't think anybody wants to hear that at this point because, you know, they either have this equipment and they're getting it to emergency rooms and clinics around the country, or they're not.
That's true. As much as we want to prepare for something horrible, we've done this before with outbreaks like SARS and MERS and all the other things that we worry about, and then we realize that we probably don't have enough. So it kind of leans back into how then do we prepare best? Ebola is a very hard disease to catch, actually, and it's only killed a number of people far less than the flu. But the fear about it is something that is even greater than we can even possibly hope to diminish.
We had actually a nurse on from the Codman Healthcare Center last night who said that she felt totally prepared. And then she even said those flimsy blue plastic covers, as long as you have on a mask and gloves, she says that's enough. Is it?
There's basic contact that you want to do for someone that might have Ebola virus disease, absolutely. And gloves, protecting yourself and protecting the patient from infecting others is very important. The risky stuff is when you actually have to deal with a bodily fluid. So if you want to test their blood if they have Ebola virus disease, that becomes quite risky. But the patients that we're dealing with right now had the disease and then infected others. So that part is where we have to discover, with the aid of very smart people in the Center for Diseases and Control, is that we have to figure out where that breach happened and try our best to mitigate that, because we will have problems with breach. How do we get people the best prepared they can with simple tools like this? And you should see what they're using in West Africa.
I wanted to ask you about that, because you've been all over the continent of Africa, not just the west side. You were in Indonesia after the tsunami. You were in Haiti after the earthquake there. And these are all cholera, every possible disease. Yeah. They can't be prepared for that. I mean, you've got to be just helping people as best you can without even worrying about what you're going to catch.
Well, these things that you've mentioned are some of the worst crises that we've seen in the last 10, 20 years. This will serve as the worst public health crisis of our lifetimes. I think later you're going to talk about
This will be?
This will be. It is because of the fear and because of the implications on the societies to which it's affecting. The fear that we have and that were expressed by the nurse earlier are tremendous. In fact, if you just magnify that even more, just think about being a Liberian who has to deliver a baby and has no place to go. The consequences of this fear have shut hospitals, have infected doctors where there were no doctors, and the implications of this down the road are quite huge. And we have to see what we can do, as much as we can do when we can, both domestically to care for our nurses and doctors, but also the need in Africa is so big. We have to think about that. They need, and they've projected that we need about 10,000 national staff and about 900 international staff to help. That will make a difference.
Do you think the CDC has blown it here? I mean, Frieden today, originally they were saying it's not, no one should be worried and we've got this contained, and now they're doing all this finger pointing at the hospital in Dallas and admitting that mistakes were made. And by the way, they let one of the nurses fly. The CDC, she called them and said, I've got a fever. No, go ahead, it should be okay. Gets on a commercial airliner, flies halfway across the country. I mean, have they blown it, or is it?
The CDC are full of the most amazing, wicked smart doctors and nurses and public health professionals that you can imagine. They are dealing with not enough staff and not enough personnel to train everyone. You know, we saw this in Katrina. Everyone was quite critical of FEMA, that they didn't respond fast enough. But the tools is that we have to be able to rely on all disasters are local. We have to make sure that our local capacity can handle things before we ask others to step in and hold up a mirror to what we're doing. It's really important that we understand our own infection protection and control procedures, and that's where the usual breaches happen. It's not necessarily the types of equipment, it's how you put it on and put it off. I think about it like scuba diving. You need a buddy to help you. It's a life support system, and if you do PPE properly, you won't get infected and you won't infect others. And it's simple steps, but a lot of it is muscle memory. If you're not used to doing it, that's when you make the mistakes.
Or if you don't have it, which is what nurses around here anyway are saying, we don't even have the gear in the first place. I can't even imagine them. You're at MGH. I mean, would they just contain it to one area? So, because you couldn't possibly outfit the entire hospital or every hospital in America, they'd have to have a certain number of these.
So what you see on TV of people being offloaded of ambulances is actually different than what you actually need to take care of patients who have Ebola virus disease. So I think some of the image around that is probably everyone's got to realize what actual PPE is. And
what does PPE stand for?
So personal protective equipment. Okay. So it's not just the big space suit.
It couldn't be.
No, not at all. In fact, some of the two critical ingredients that you have is the simple spacesuit. Literally, it's like a paint suit, and then you have a hood, and you have goggles, and you have gloves, and you have at least 2 sets of gloves, and you learn how to take them on and off without touching your face, your nose, and then you can put them aside. And those things are very easy to have in the United States, and we have stockpiles located. But in order to take care of a person that showed up to me in a clinic, I'd go, oh, you have a travel history and you have a fever. Let me step out of my room, because I can't catch Ebola from you if I'm standing this far away from you, which is 3 feet. I can't catch it.
Nobody believes that.
No.
I know.
What's great about Ebola, it's not airborne.
Yeah. That's what I know, but Americans anyway are having a hard time believing that. All right. Hillary Cranmer, thanks so much for your expertise. Appreciate it.
Thank you.